right. Good afternoon, Josephine. How are you today?
I'm good. How are you?
Very good. Thank you very much. So we are talking a little bit about your experience. It looks like you have a pretty vast medical background. About how many years would you say that you've been in the medical field?
Um, I want to say like 6 years.
So let's see here, 2020. So if we count the vision. So yeah, going into that, that fifth year or so. All
Yes.
right. So most recently you were with Flagler Health and you were their centralized scheduler.
Yes, ma'am.
Okay. So tell me a little bit about what that job entailed.
So basically I was in charge of scheduling um different types of procedures for the hospital, surgical procedures, um, CAT scan procedures, MRIs, um, other type of special procedures.
So were you communicating with the patients specifically, or were you communicating with the offices as well?
Both. We
With
we we did both. Yes, we
Okay.
took in referrals from the doctor's offices. We did have to call them on occasion just to get clarification. We did have to call the patients to get them scheduled, to get all their health information. Um, yes, ma'am.
Okay, so lots of phone work. I'm assuming multitasking.
Correct. Lots of phone and computer work.
Okay, great. And then what did you do before that?
Before that, I worked for HCA Hospital up in Jacksonville. I
Okay.
did registrar, so I took in patient information. I took co-payments. I also did the scheduling for them as well.
Okay. How's your medical terminology?
Um, I wouldn't say great, but it is fairly okay.
Okay. Um, Now you have it's a certificate or degree?
I have an associate's degree in health science, and
Okay.
I did take medical terminology as a
Okay.
class.
Perfect. Now, with any of these positions, have you ever worked with anyone who was in an accident, maybe that required, different types of records to be sent, or did you ever have to work with a law firm? It's okay if you didn't. I'm just wanting to, check in on what that skill
Mhm.
set looks like.
So I've never had to deal with a law firm.
Okay.
We did get some subpoena request every now and then that we had to send the patient's medical history,
Okay.
um, but not really directly with a law firm.
Okay, so you were doing actually on the opposite side of the position, that we're looking for. So if you're needing to send the record, so in a law firm, you'd be working, getting the records from the
Hmm.
doctor's offices, and so you were working on the flip side of that.
Yes,
And so you're not currently working now,
I am not.
correct? Okay.
Correct.
Were you at your last job for about a year or so?
About 2 years.
Oh,
Hmm.
2 years. Okay, hold on. Let
Hmm.
me make sure that I
It's
have
like
that in.
I started January
Oh, in
6th of
2023.
23. Yeah.
Okay. And so, and you're in Palm Coast, but you're looking to commute. You're okay with that commute going to Daytona. Okay,
Yes, ma'am.
gotcha. All right. And what's your availability during the week? Are you open 8:30 or open from to work 8:30 to 5?
I am. Yes, ma'am.
Okay, great. Do you have anything on your calendar in the next 15 weeks or so that we would need to know about that would require you to be out of the office?
No, ma'am.
Okay, great. And let's see, I think that's about it for this part of the interview, but don't go anywhere. I want to talk about a few more things.